Hey, it's Dr. Frank at Walden Dental with another episode of Tooth Talk, to where we talk about beyond the scope of just dentistry, overall healthcare and wellness. Today I have Dr. Knell from Austin Oral Surgery, who's an oral surgeon. He is exceptional on knowing how to offer advanced elements of dentistry that go beyond just your normal general dentist experience. Whether it be your wisdom teeth or dental implants or understanding some conditions in your oral cavity there that dentists may not know about. He's an exceptional referral source with a wide range scope of knowledge. And Dr. Knell, thank you so much for being here.
Thanks for
to
having
help kind of introduce you a little bit more. Tell us a little bit about yourself and also getting a little bit deeper dive into how oral surgery is really helping our patients today.
Thanks for having me, David. I, as you said, work at Austin Oral Surgery. It's a practice here in Austin. We kind of have broadened our practice throughout the area. 12 offices, 13 doctors.
Wow.
I've been here about 8 years.
Yeah.
As an oral surgeon, as you said, I'm specialty trained. So oral surgery is a specialty in dentistry.
Mm-hmm.
Obviously, do a lot of surgery. We do anything from wisdom teeth, impacted teeth, general extractions, dental implants, bone grafting in preparation for implants. We do corrective jaw surgery, someone that has an underbite or an overbite. Do oral pathology, so biopsies, cosmetic surgery. Some oral surgeons will do some cosmetic surgery like Botox, rhinoplasties, facelifts, brow lifts, and then trauma surgery. So facial fractures, lacerations, dental trauma like fractured teeth,
Right.
that kind of thing. And then also seeing pediatric patients.
Okay.
So we do a lot of pediatric surgery. Anything from extractions on little kids to biopsies or dental traumas.
Wow. I mean, way beyond the scope of just conventional dentistry, and you have a medical degree
Right.
as well. So tell me a little bit about how that helps so much when it comes to the dental component of not only being a doctor in dentistry, but also a medical doctor, and how all of that relates together to be able to provide that next level of care and service.
Yeah, so as an oral surgeon, you really have two options when you're training. You can do a 4-year program or a 6-year program. The 6-year program in residency incorporates medical school.
Yeah.
So when you get the MD, you have to do 3 years of medical school, take all of the proper exams, and go through a residency in general surgery, and then do an oral surgery residency. So you're able to treat a lot of patients from anything from a routine medical history to someone that's very complex, geriatric patients or young kids. So when you treat patients with a lot of comorbidities, such as diabetes, renal disease, cancer patients, having that medical background really opens your eyes to a lot of things. It allows you to be comfortable really in treating anything. If you have that contact with the medical community, which helps a lot, you're able to really manage cases a lot more effectively. But there's really nothing that we can't see as oral surgeons, and I'm comfortable really treating anything. And when you send a patient over that has a fairly complex medical history, you're trusting that I will kind of incorporate that knowledge, which is best for the patient.
Mm-hmm. Dentistry in oral surgery is not only about cavity chasing,
right,
and trying to fix problems. Tell us a little bit about, on these routine evaluations and examinations that we're able to do in the oral cavity, we have the ability to identify a lot of other systemic related illnesses, other lesions that may present in the mouth that have a much bigger, deeper impact in the rest of the body. What can we see to help let patients know, hey, there's more to you than just this examination of your teeth, and where we have some concern that you need to be seeing your primary care physician,
right,
or needing to see potentially other specialists to rule things out, because we have a really easy way to do that examination without having to put someone under.
Yeah, so you see patients all the time that have things going on they don't realize. So maybe like a little bump in the mouth, or a color change on their gum tissue or tongue. They may have a lot of cavities in certain areas because of something like maybe dry mouth, or they have a pretty routine surgery and they just don't heal well from it. Little things like that you start to look at a patient and say, hey, why is this going on? And there's usually something systemic related, something like being immunocompromised or diabetic. They're not healing well after a surgery, or they have an autoimmune issue and it's causing some changes in the oral cavity. You can see certain ulcers or tissue changes in the mouth secondary to an autoimmune problem, and then also medications that patients are on. A lot of times they're taking a lot of different medications that are acting in a certain way to affect them, causing problems in the mouth, causing dry mouth. So we look at these things. We do thorough medical histories, ask them a lot of questions, medication questions they never would have thought we would need to know, and using that information, kind of get an overall picture of what's going on with them. And then talking to their primary care doctors and saying, hey, this patient's on this medication and I feel like it's going to do this with their surgery. What do you think about that? Right. Or, hey, you need to see your doctor because I think your blood sugars are way out of control because you're not healing. And, they haven't seen their doctor in 2 years and aren't using their insulin. So it's things like that dentists, oral surgeons, really anyone in the dental community can see. Hygienists a lot of times we'll see stuff like this too. So I think it's important that patients understand that we're not just dentists. We do a lot of different things. We're experts of the oral cavity and the oral health. So
and its implication on everywhere else that can happen in the body. I think a lot of these things that can brew into larger problems is probably based off of fear. Fear of the unknown, fear of past dental experiences as a kid that have really kind of scarred them and conditioned them to think anything that happens in the dental office is going to be painful and bad. Can you help us understand what your services and your abilities to make dentistry not only not fearful, but in an extreme sense to where they don't even remember it, in what type of levels of sedation for those patients that are just like, you're not going to be able to keep me in the chair because of all of those bad noises and sensations and the fear of the drill, and heaven forbid I have this infection. They'd rather hold on to the infection than being able to make that phone call to get to the dentist. What can you help on alleviating those if they do have a need?
Yeah, so as you know, most patients show up with some level of anxiety. Every day we see patients that have those stories. I had a bad experience when I was a kid, or a dentist had to stand on my shoulders to take a tooth out, something like that they had in the past. So they want to be treated with as much comfort as possible. And the benefits of what we do as oral surgeons is we can put patients to sleep. We can use IV sedation techniques to make it a more comfortable experience. As an oral surgery resident, we do many months of anesthesia. We train with anesthesiology residents, more so than any other surgical specialty. And during that time, we obtain the expertise to treat patients with anesthesia, and that can range from just a mild sedative to make them, comfortable and loopy, to where they're asleep and not able to be aware of what we're doing. So probably most patients in our office are put to sleep for the process because they're anxious and don't want to hear the sounds, don't want to know what's going on. So in our practice, we have patients present with nothing in their belly, so no food or drink prior to the appointment. We start a little IV. Sometimes we use laughing gas during the IV to kind of help comfort them, take the edge off. And then we start giving them medication to make them go to sleep. It acts quickly, and then we can do everything we need to do. Once we're done with surgery, stop giving them medication. They wake up fairly quickly. So the benefit is you're asleep fast and you're awake fast. You don't have that prolonged groggy sensation. It's similar to patients. A lot of patients have had an endoscopy or a colonoscopy. It's this similar sedation process, and we can do that on young kids, and we can do that on patients in their 90s, and kind of
That's great.
just adjust what we do depending on their age, their weight, their medical comorbidities. And we find as oral surgeons that most patients after they're done say, that was an amazing experience.
Right.
I can't believe I was anxious that I was going to go to sleep. I wish I would have done this 10 years ago and not put off getting my wisdom teeth out because I was afraid. So we do offer oral sedation where we give patients pills prior to the surgery, but find that doesn't work as well as using an IV. So just from a comfort standpoint, I always tell patients that's going to be the best option. Yeah. But we'll just decide with a conversation with the patient what's best for them and go with that.
Awesome.
Yeah.
I hope everyone enjoyed this latest episode. Again, filled with so much information, the exceptional knowledge base and expertise that Dr. Knell and all of Austin Oral Surgery that can help Central Texas is amazing. Stay tuned for other healthcare episodes coming up. Again, this is Dave Frank at Walden Dental and another form of Tooth Talk. Take care, live well, and smile.